Totally okay with that.
Same. I voted to have it tomorrow.
Hi,
Hi,
all.
Miss Hampton.
Hey, Miss Sampson.
Hi. I feel like we've been with each other all day between our phone calls and our texts and our online, which is not a bad thing.
No, I appreciate it.
Did anybody get a chance to watch the video from this morning?
I did.
Or
Even
anyone
if I was there.
at the start? Yeah, Shannon, you weren't with us this morning.
Yeah, I watched it.
Okay. Most people wanted a review with units 1 and 2 seemed to be where most people struggled. We can go to any question unit wherever you guys want to go. I've got about 45 minutes because then for anyone who hasn't had a chance with me today, for 10 to 15 minutes to review past test questions of where you struggled, then we'll do that only by phone call. So a lot of you that I've had that already. I have not had one with Shannon, and I have not had one with Michaela. And Amanda, we kind of did something over email. So if you want an opportunity for that, then we'll do that after our review session, and you can choose which test questions to review and go over. So what do we want to start with today?
I had a question. Do we need to know about like anything with who regulates what?
There were some questions on that in the previous test on that too. So it's good to know that going forward too. As far as for OSHA and CDC, we did have a question on that, a couple of those on past exams. So you might see that again.
Okay.
I know like OSHA does the transportation. That like confused a lot of people.
Yep. Yeah. That was one of the questions. And
yeah, that was one of the ones I definitely got wrong.
Yeah, same.
So OSHA takes care of us at work. So if you're at work and you're doing transport and handling of materials, that's going to be OSHA regulated that says you don't get to carry a syringe walking around. You have to put it in a container to transport it. For something like us versus OSHA saying you have to wear a hard hat, you have to wear work boots because those protect you. So OSHA's in place to protect an employee.
And the CDC is for everyone else, right? Like the
Centers of Disease Control and coming out in governmental agencies and in our germs and following protocols with disinfectant sterilizations and things. One of the test questions that was confusing, I remember back to, was regarding the ADA seal, but we're going to go with what the book says. So who remembers the ADA seal of acceptance and how long that lasts?
It was like 3 years, 5 years.
It's 3.
Okay.
For the book, and that was, I think some people could find information online that it was 5 years, and then it was 3. But in the book, they state 3 years. So we'll go with what the book says.
For 3 years, got it.
3 years. Yep.
It was 3 years for what?
For the ADA
seal.
Oh, seal. Okay.
Mm-hmm. Okay, so you guys will have, is your perio final still, is it tomorrow? Was that the consensus to get it done? Okay. What time does that start?
12:30, I think.
Okay. Okay. All right. So what you've been studying all day, what do you have now? Because and Janet, if you want to have a call with me afterwards, we can go through past test exams, about 10 to 15 minutes worth.
Okay.
we're on.
What time do you have for that? Like right after this, or like do you need time to go like eat or anything, or?
No, I'm trying to do that now. So I want to give you guys each your 10 to 15 minutes pretty straight after the meeting, because I'm tired. I was up till 1:30. I'm taking a bath and I'm going to bed.
Sounds like a plan. Yeah,
Doesn't
I'm
that sound like a plan? No, I'm going to be in crazy mode because I defend my theses in 8 days and I haven't done my slides for my PowerPoint yet. So I want to take care of you guys and get you guys through your stuff first.
At least you're done with us after tomorrow for a little bit.
Yeah, I will be done. So hopefully they have a few things for me to do, but otherwise, yeah, guys can still ask me questions on that, but I'll be focused on theses stuff, getting that done. Okay, back to you guys. Is everybody familiar with Black's classifications?
Yeah.
Yeah.
All right, so that's good to know on that. You've had a chance now to review notes and things back to Unit 1 and 2 when we started talking about the bonds and all those chemistry type of things. That was pretty confusing the first time around. And after reviewing with several of you, many of you were getting the right answers this time around, starting from Unit 1 all the way now to Unit 7. You've had more time to practice and think about it and understand it more, so you're putting 2 and 2 together, so that's good. Any specific questions, things that we need to go over?
So I was reviewing today. I don't remember putting like a lot of emphasis in viscosity, or like high viscosity, low.
Well, let's just have a general, just easy chat on that as far as viscosity then.
Okay.
What does it mean? What is it?
Ability of a material to flow.
Wow.
Yes.
Yeah.
I got my notes here, so.
Okay, all right. So if something has high viscosity,
It's thicker usually.
if something
I'm
has a
so
low
ready.
viscosity,
It's easier. It's like runnier.
Yep.
so when we're doing composites and fillings, we look for, there was a question regarding high viscosity, low viscosity, none. And now that we've seen how things are labeled and we're looking through different directions and things, do you typically see high viscosity or do you see low viscosity?
Mostly low.
So we want it to be relatively low for most materials, because we need some viscosity, we need some movement. But
What would like no, I'm like blanking on the words right now. Not an agar, but the other one.
Alginate.
the hydrocolloid,
What would that be considered an alginate? Because like once it's liquidy, it's like runny, but once it's hard, or is that completely different?
so that's a little different from what this is talking, is more as like your composites and your etches and your materials of that. But that's going to go more if it's reversible, irreversible, hydrocolloid, agar in that section. But
Okay.
but you could correlate it to high viscosity and low viscosity in anything that you do in dental. But okay.
Okay.
You guys have reviewed the different bonds. We talked about that this morning, knowing metallic hydrogen bond, our permanent dipole versus a fluctuating dipole.
Yeah.
Yeah, that confuses me a little bit, but I think I understand it.
Just don't go too deep. It's just going to be like, you know, what we've talked about from that in class and in just in our notes too. We don't need to know who invented what and tested this and all of the years and stuff. Just the basics. So if I'm thinking like what Shannon brought up, and with alginates and of that nature. That's not a plastic or a metal, but we're getting into our colloids like the Jello. It's got a couple different phases that goes in. And then we talked about early that plastic, how are those, who remembers that we talked about with plastic versus metal? And most people understand that a composite is made up of how many or more materials?
Two. or
Two.
more.
Two or more materials. So colloids like the Jello, like the alginate, it's got our two phases. So basically a covalent bond is two atoms sharing electrons. So it's how are they sharing it? So how does a plastic share its bond as far as what does it look like? Does it look like it's a little spot here? It's a little spot here. Does it
Isn't it
look like it's repeating units? Does it look rock solid, all even, more like a metal?
Repeating.
That is our covalent bonds are our repeating units. And ceramics, they're strong, but they can be compromised and brittle when pulled or bent. So a ceramic is an ionic bond that you can have a nice strong ceramic crown on your front teeth that is fine and standing up to things until you run into the side of a door or something and fracture it. The book is an example of table salt. That's hard, but you can easily squish it when you have enough pressure to compromise it, and then it makes it turn brittle.
Do we need to know anything about rubber dams for the final, like whether it's like the techniques or anything like that?
Any question that you possibly saw on the final or on your unit tests could be on the final. And
Yeah.
we spent a lot of time on rubber dams and learning how and going through it. So I'm going to say the likelihood of that is high.
Okay.
And that is on some of the unit test too. So Shannon, if that's something that you want to go over, we can do that too, if you choose to have a 10 to 15 minute phone call session. But yeah, so if for a rubber dam, what are some of the important things that we talked about regarding a rubber dam?
The floss.
So what does the floss do?
Preventing aspirating.
On what?
The clamp.
Yep.
Yeah.
So it's the little clamp. We want to floss it, go in there. People tend to get confused between the floss versus a ligature, because you can use floss as a ligature, you can use the actual ligature strip, and you can actually use a piece of the material for the ligature strip. But if a question is talking about aspiration, that's where the floss comes in. Same as on your bite block. You should always have floss. I've never known anybody to swallow a bite block, but it could be if you only had a small one and you were using it on a large male, that could happen. But usually that would be pretty rare, but it must have happened for somebody to think about it to floss there. What is the difference in between the permanent dipole and a fluctuating dipole? And this is what I told the morning session, is just review that page 26, 27. It's got a lot of these terms on it just to understand the basics between a plastic, a metal, a composite. Which one's more strong?
The permanent.
Because it's permanent, it's strong, it's pulling that electron toward it and hugging it. So it's making it tough and strong and more permanent, versus it's fluctuating. It's an uneven distribution. So the book gave an example of like the light at night and the bugs, that the light could be all covered with bugs, but part of it starts dimming, maybe the others is shining and all the bugs go this way and it's going. If it was a permanent dipole, everybody stayed the same place. So just a little visual, but just a basic difference to know which one's stronger and permanent.
So the permanent one is like a strong magnet. And
Yeah.
then the, what is it called?
The fluctuating dipole is
The
maybe
fluctuating, like a weak, really weak magnet, like those cheap ones you get that just fall right off the fridge.
Yep, or I think about have any of you who've got kids, there's all the little or little pieces that they stick on here. They're all little pieces of metal and it looks like it's confetti and they're diamond shaped, but you can go all over with it, but they're magnets. And if you haven't, don't ever buy your child or your nephew or your niece that, because it's going to be a bad idea for the parent, because I'm still vacuuming those up. But it's not strong. It's fluctuating. Vapor pressure. There was some problems between what is a vapor on the unit exams, which going back now, you're going to be able to answer those questions much better than you did the first time around. So what's a vapor?
Evaporation from liquid to gas.
Yeah, so it vaporizes. You had the liquid, it goes to the gas, like your humidifier, like your vaporizer.
Mm-hmm.
Thinking of that. Okay. What else in that chapter? Unit. There's a couple more universal ones that many people got wrong. And most of the people were reviewing this now, that it's okay if you don't want to have a phone call to review for unit 1 or unit 2, because we're going over a lot of that right now. But coefficient of thermal expansion. People mixed up volume and temperature. So tell me what it should be.
I forgot the question. What was it?
The coefficient of thermal expansion. What is that?
Oh, yes. That, oh, what was that? Oh, yeah, that's the volume to temperature.
That's
Change in volume that affects, the temperature affects the volume or something like that.
well,
So-
more than something like that. Know which one does what, because you'll probably see both choices if that question comes up, because that's how it was in the unit exam. So the change in the volume in relation to the temperature. So
Yeah,
if
like
you blow up a balloon and you're inside, it's all full of volume, and you're going to go outside and it's cold, you're going to get shrinkage. You're going to get that change in volume because the temperature did it. The volume was still there, but the temperature shrank it.
So you said it was change in volume in regards to the temperature.
In relation to the temperature. So that comes into play how in dentistry. What type of, let's talk about restoration materials.
Like amalgam?
Yeah, it can be amalgams and it can be composites. Think about what you've seen in clinic now between a macrofill and a microfill. So what are differences between those?
The macrofill has larger particles.
Larger particles, it's older, it's going to be more prone to expansion and contraction versus microfill, which micro, small, harder to see with the naked eye, is going to be your more updated filling. So macrofill, composite filling, you're going to see on maybe your 70-year-old patients who had their composites for a long time, and you're going to clearly see it is not the same color. You might have a dark edge around it. You literally can maybe see it pulling away from the tooth, because those macrofills expand and crack, or expand and contract, and then we're going to get micro leakage. When we get micro leakage, then we end up having to replace the filling because of an open margin. So if we see an open margin, that means you can't do anything with fixing that. We have to replace that. So earlier this morning, we talked about percolation. So Janet or Shannon, who knows with percolation? And everybody can help each other. I'm just saying the others have seen it already. So percolation, I gave the example of like your grandparents, your great grandparents' old coffee maker where it'd have a glass top and you'd see it percolating up and down, heating and cooling, expanding, contracting is what percolation is. So if you have a material that's doing that back, forth, the longevity of it is not going to be good and you're going to have more leakage. And that's what those macro fills did. So they're usually not used anymore. But you were going to use a microfill and then we'll have some sort of hybrid to go over it on the composite.
And that's only for O and MO, right?
It's going to be on the margins.
Okay.
So if you had an MO, it could be on the occlusal surface, but that isn't what we're going for because it can be an MODO, so it's on margins.
Okay.
Okay. What about toughness and hardness? We talked about that too. As far as what one has the ability to distort and which one is the ability to resist scratching and indentation. So what's toughness?
I forgot the toughness one. I just have the hard one.
Okay, here's my example. So a Rubbermaid container to put your lunch in is tough. It has the ability to distort, but it's probably not going to be fracturing. As a glass container is really hard and the ability to resist scratching and indentation. So toughness is the ability for the material to distort but not fracture. And hardness is the ability to resist scratching or indentation. So material can be tough, but it might not always be hard enough, such as a beautiful porcelain crown on number 9 again, and you ran into it and you hit it. It was tough, but it wasn't hard enough to withstand that scratching and huge indentation that you have on your front tooth. Okay. What else do you want to talk about?
Can we go over the shots again? I know the PV, that one is done in 3. The TDAP is done every 10 years, and then influenza is done once a year. But wasn't there one more that's like done like 4 times or something like that?
Let's see. You got the tetanus shot. That's 10 years.
Yep.
Okay, and then which is the TDAP. Then you've got your hepatitis B, HPV. So that one is you have one, then you have one a couple months later, then you have another one 5 minutes later, or 5 months later. So that's our series.
Okay.
And then the flu is recommended yearly. So yep, tetanus was 10 years. Okay, let's see. By this time, a lot of students didn't do so well regarding sealants, but now that you've been through sealants, then I'll look forward to seeing nicer scores that.
Is it good to know like different times, like 15 seconds and like the 30 seconds? For like it and drying it?
That could come up, but don't think of so much as the procedure in lab, and think of more lecture things, as in what makes a good sealant. What do we want to see in a good sealant? What do we not want to see? What do we need? What makes a sealant fail?
Okay, moisture.
Yeah, contamination.
So it was contamination from moisture because it wasn't isolated well. and then it's not going to work. And why do we do a sealant?
To prevent decay.
Yeah.
Yep. So what kind of teeth get sealants?
Molars and premolars.
So,
Why
because
does it have deep
With
fissures?
deep pits and fissures,
deep
yeah.
pits and fissures, right? So would we give, if somebody's never had a cavity before, would we recommend putting sealants on?
No, not if they're older.
Right. That was a clue. Not if they're older. They have to have an elevated caries risk in order for us to do that. With kids at age 6, age 12, it's pretty typical because they're most likely not the best little tooth cleaners at that age. So one thing we talked about this morning is because to go through different philosophies on this, but according with our book, if there's an incipient in the pit and fissure, knowing that the sealant material, some sealant materials may release some fluoride. So an incipient means it's still in the enamel, it's not progressed to the dentin. And if the dentist says okay, then we can put a sealant on them. But what we would not put a sealant on is somebody who wouldn't need it. So there was a fancy word that you guys saw, and it was coalesced. So somebody who has very shallow grooves, it's minimal depth, it's pretty smooth, they're not going to, as we're thinking of patient-centered dentistry, we're not going to need to seal them. It most likely isn't going to seal. Doesn't mean everybody needs sealants because they have grooves. You know, you could have a 45-year-old patient who has groovy teeth, but they've never had a cavity before.
What was the term that you called that?
Coalesced. C-O-A-L. Coalesced. And this question threw people off too, so I want to review. Why do we use the pumice and the brush before we want to put a sealant on?
Can you repeat that?
Why do we want, in regards to a sealant, why do we pumice and use the brush before we would do the sealant?
To clean everything out.
Right, so if somebody has good, effective plaque control, would we have to pumice?
No, I
No.
got that wrong last time.
No. So if someone's clean, like you're having more adult patients, you know, if you're having a kid in, you're going to do it. It's probably messy, but there's, as we know, adults who can have sealants too. And you're most likely not going to have to do that because you'd actually waste product, waste the brush, and not need to because the acid etch is going to be all that you need. We always have to etch. We don't always have to pumice. So I noticed that there were quite a few questions that have not in it and except in it, to really focus on those questions, to know what it's asking. Because if something says, if this is not indicated, that means there's 3 things that are indicated. So read it back to yourself, such as for sealants. What is something, I don't remember what the question was, but what are we going to, all of the following are things that we do to know that we placed a good sealant, except, and then it goes through that we are going to visually check it, we're going to try to dislodge it, we're not going to floss it, and we're going to use an Explorer to check it.
Wasn't it the floss one? Like we want to use floss?
So that threw people off because you focused in on floss, but you have to see if it's I'm going to or I'm not going to. So it threw people off because it says to not floss, but we do want to floss.
Right.
So just to make sure you're going slow, not too fast, really thinking. And, you know, on when we're proctoring these exams too, you know, I can see who's going back and forth and thinking, and it is go with your gut. Try to not go back and forth and to go back and change answers too, because it's usually after it's changed, it doesn't work out as well as what the initial answer was. So go with your gut. You guys know a lot more now than you did when you first took these exams. So it's difficult to go back and say, I scored poorly on this exam, this exam, this exam. But going back, most of you who I've reviewed with, you've gotten at least 75, 80% of those questions right this time because you're understanding it more. Putting 2 and 2 together. Let's see. Know that amalgam polishing and amalgam finishing, it's in the same step, but what's done first?
Finish.
Finishing, because just like a finishing burr doesn't mean that we finish it. It means that we start with it. A finishing burr is just a type of burr. There's thousands of names of burrs. So we're going to do most of our work, if we need to remove those pits and roughnesses on our amalgam with that, and then we'll go through and polish. So there's amalgam finishing, there's amalgam polishing.
Ouch.
Okay.
Wait, and then so that amalgam finishing, it doesn't have to do with like the placement of the amalgam necessarily. It's smoothing it at a later date.
This is where we're thinking about our amalgam polishing.
Because I think I remember a test question like that where I was very confused by at what point we're talking about, because I just aligned what we do as hygienists, are like the polishing, as what they were talking about. And I'm like, well, finishing, that doesn't sound like that.
Yeah. So now you know, first we have to use the finishing burr and finish it. It doesn't mean that we're ending it. In this case, it means we're starting it. And then we'll go back with our polishing. And do we start from fine to heavy grit or heavy to fine grit?
Heavy to fine.
So we're going to wean ourselves down to make sure that it's nice and smooth. Okay? We got a few more minutes. Who wants to talk about what?
So then I think we talked last time about the final impression material.
Mm-hmm. So that we aren't going to use our alginates and using what we use for our study models, because those are a little bit low key. What do we use our study models for?
Patient treatment.
Mm-hmm.
Education.
Like education, whitening, progress.
Yeah.
We're going to have a full tray, and we're going to use our hydrocolloids, our addition silicones. We're going to be using and working with our crown and our bridges and our fancy things, because it's going to be more detail.
Right.
Okay. And everybody remembers what the difference between the cast and the dye.
Dye is 1 tooth.
Yep. That's good to know. Okay. Who wants to have a review session on past test questions for 10 minutes or so after this meeting?
I'll do one.
Janet? Okay.
I think I'm good, Miss Hampson.
Okay. Okay, so Janet, I'll give you my number and then you can give me a text, okay? Or call, whatever, whenever you're ready to go.
Okay.
Which as soon as when we end this, I need to take a potty break and then let's do it. So 612.
I'm gonna email your number then. Oh, hold on.
I'll just give it to you.
612
804 4311.
4311.
Mm-hmm.
Okay.
Okay. Any other questions? This is good that you guys have done this, because some of you have done this twice and most students have done this not. So hopefully people are watching our sessions and getting some good stuff just to add to your armamentarium of your final.
I think they're so helpful.
I know.
Well, it's nice to talk it out and listen to other people's takes on things and just review it, which is why I just think we needed to do something like this just to help the transition and just go through it. So I'm glad you guys attended, and I think you'll be well off for doing so. Okay, so we'll be set, and Janet, give me 5 minutes and then call, and then we will review whatever tests that you want to review.
Okay, sounds good.
Okay, bye guys.
Thanks, Ms. Hanson.
Yeah, bye.